and welcome back to this segment on our channel called Answering Your Most Googled Medical Questions by Heidi Gastro, and today's video is a super common and super interesting one. So let's get started. So in today's video, we'll be exploring the question, what are the 10 causes of hair loss? So on average, all humans lose anywhere from 50 to 100 hairs each day, and this is considered completely normal. But by the age of 50, about 85% of men and around 50% of women will experience some sort of balding. For many people, losing their hair comes with great psychological costs. When looking around, it's easy to feel like everyone else has a hair full of hair and you don't. For many, it diminishes their confidence in who they are and how they feel on a daily basis. And while this reaction may be perfectly natural, the truth is that millions of men and women suffer from extreme hair loss. So here are 10 causes of hair loss. Number 1 is androgenetic alopecia. So androgenetic alopecia is another term for male or female pattern baldness. Both male and female pattern baldness is usually genetically caused, and males tend to lose hair from the temples and the crown regions of their head, and females suffer from hair thinning all over their heads. Number 2 is pregnancy. So many women may experience excessive hair loss during pregnancy or shortly after giving birth. This is due to a decrease in the body's estrogen levels. But the great thing is that this type of hair loss is usually a temporary condition and usually resolves within a year or sooner. Number 3 is telogen effluvium. So telogen effluvium is a condition where the hair remains in the telogen or natural shedding phase of the growth cycle. It is a form of temporary hair loss that usually happens after stress, a shock, or traumatic event. The hair loss here usually occurs on the top of the scalp and may cause hair to fall out rapidly, sometimes even in handfuls. Number 4 is Anagen effluvium. So Anagen effluvium refers to hair shedding that arises during the anagen or growth stage of the hair cycle. Exposure to certain chemicals such as thallium, boron, and arsenic can precipitate Anagen effluvium, in addition to chemotherapy and radiation therapy as well. Number 5 is alopecia areata. So alopecia areata is an autoimmune condition that causes hair to fall out suddenly and even in big chunks. The main trigger point here is the immune system attacking the hair follicles along with other healthy parts of the body, thus causing the hair from the scalp as well as the eyebrows and eyelashes to fall out instantaneously. Number 6 is traction alopecia. So traction alopecia is extreme hair loss due to pulling hair into tight hairstyles, such as tight buns or ponytails, braids, cornrows, or extensions, which causes the hair to break free and come loose. In cases of chronic traction alopecia, the person may eventually develop bald spots and thinning of the hair in certain areas of the scalp. Number 7 is medications. So many medications have side effects that can cause the hair to fall out. If a person thinks that their hair loss might be due to medication that they are taking, they should consider seeing a doctor for an assessment, as he or she may be able to reduce the dosage or switch the person to a different medication. Examples of medications that can cause hair loss include blood thinners such as warfarin, Accutane, which treats acne, antidepressants such as Prozac and Zoloft, beta blocker drugs, and some cholesterol-lowering drugs such as Lopid. Number 8 is nutritional deficiencies. So extreme diets that are too low in protein and certain vitamins such as iron can also sometimes cause excessive hair shedding. Number 9 is birth control pills. So many people may experience hair loss while taking birth control pills, and may even experience hair loss several weeks or months after they stop taking them. The pill suppresses ovulation by the combined actions of the hormones estrogen and progestin, or in some cases, progestin alone. Women who are predisposed to hormonal-related hair loss or who are hypersensitive to the hormonal changes taking place in their bodies can have hair loss to varying degrees. Other forms of birth control that affect the hormones, such as implant and skin patches, may also cause hair loss too. And finally, number 10, which is the scalp ringworm. So tinea capitis is a fungal infection of the scalp involving both the skin and the hair. It is also known as the scalp ringworm. Symptoms of tinea capitis include hair loss, dry scaly areas of the scalp, redness, and itchiness. And that brings us to the end of this video. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share. And please make sure you turn on your bell notifications so you'll be notified every time we have a new upload. If you would like to help us make better videos and content, you can also donate to us on PayPal. Take care and thanks for joining me today as I explored the 10 causes of hair loss.